We're presenting a data in a poster discussion session on Tuesday with data with RICTOR amplification as a potential biomarker for targeted therapy in a subset of patients with lung cancer. It's really truly a translational effort. We had a young patient, 18-year-old with non-small cell lung cancer who was never a smoker. And he was diagnosed with lung cancer, was treated with the traditional chemotherapies, and had a progressive disease. When we are trying to understand why he developed lung cancer, trying to look at different markers, we did a next-gen sequencing and find out that he had a RICTOR amplification. So RICTOR is an oncogene which is downstream to mTOR pathway. And it's an important protein that complex with mTOR2 and send the signal downstreams. So RICTOR amplification have been implicated in other cancers, including glioblastoma, as potentially oncogenic in cell lines, and has never been described in patients with lung cancer. What our abstract is presenting is that we look at two large data sets. One is from Cancer Genomic Atlas Project from NCI. We want to look at what the incidence of RICTOR amplification in lung cancer patients, and we found out that about 7 to 8% of non-small cell lung cancer has RICTOR amplification. We also collaborate with our colleagues from Foundation Medicine and look at the database with the next-gen sequencing of patients with lung cancer, and found out that about, again, 7 to 8% of non-small cell lung cancer patients has a RICTOR amplification. Dr. Chang, my colleague who will be talking after me, has also done some preclinical work. We screen a fairly large number of non-small cell lung cancer cell lines for RICTOR amplification and identify a few cell lines that have a RICTOR amplification. And we tested a number of targeted therapies that target the mTOR pathway to see which drugs will work better. Our preliminary data show that the pan-mTOR inhibitors, mTOR1 and 2 inhibitors, has better activity in RICTOR amplified tumors versus, mTOR1 inhibitors or PI3 kinase inhibitors. As a proof of concept, we sent our patient for a phase 1 trial with the mTOR1/2 inhibitor. And the patient now had a stable disease after having a progressive disease. He now has a stable disease for over about 11 to 12 months, and he's continuing on the drug. So we're really hoping that RICTOR amplification would define a new subset of patients with lung cancer who could potentially benefit from mTOR1/2 inhibition, and we have yet to see how this is going to translate into.